And welcome to the Dr. Bob Show. We'll be spending most of this show talking about a condition called sepsis. Sepsis is the body's overwhelming and life-threatening response to infection. 10 to 50% of people that have sepsis will die. 1.5 million people in the United States will get sepsis every year. Can we prevent it? Can we treat it rapidly? Can we diagnose it? Yes, we can, and we can help lower the death rate on sepsis. My guest is Dr. James Shamiyeh. Dr. Shamiyeh is a board-certified pulmonologist, and he heads the sepsis program at University of Tennessee Medical Center in Knoxville. He'll be our guest. He'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about a connection between high blood pressure out of control, and brain problems. And also, if we have time, we'll be talking about bunions. Are they hereditary? Could be. They sure cause problems if you got them. A lot of information for you. We're talking with Dr. James Shamiyeh, board-certified pulmonologist and head of the sepsis program at the University of Tennessee Medical Center. James, welcome to the Dr. Bob Show.
Thank you very much.
What is sepsis?
So sepsis is caused by the body's overwhelming and sometimes life-threatening response to an infection. So first of all, there has to be an infection, and not every infection leads to sepsis. But when it does, what essentially is happening is that the body is releasing chemicals into the bloodstream, part of its attempt to fight the infection, but those chemicals end up inadvertently creating so much inflammation. It's kind of inflammation run amok. And what that inflammation can then do is affect blood flow to some of the vital organs, which can really start to lead to a lot of damage.
So does it cause shutdown of some of those vital organs sometimes?
It can. There's a spectrum of sepsis. So there's anything from mild sepsis to something called septic shock, which a lot of people may have heard of. And so what essentially is happening in septic shock, the word shock implies problems with blood pressure. And so that process, that inflammation run amok, has gotten so severe at that point that even with intravenous fluids and even medications to support blood pressure, we're having a hard time maintaining somebody's blood pressure, and then the organs just start failing.
How common is sepsis?
So it's actually quite common. It's much more common than most people realize. So if you think about in the United States, a rough number would be about 1 million cases a year.
1 million cases a year. So it's going to happen everywhere you see. Are there certain causes of sepsis?
So first of all, there has to be an infection. And so if you think about which sources or sites of infection are most common, it's going to be what people would probably guess. So first of all, the lung or pneumonia. That causes about 35% of sepsis cases. The second most common is the urinary tract. So that's the infection of the kidney or bladder. And then skin infections are about 11%, and then infections of the intestinal tract is another 11%. You put all those together, you've got most of the sources of the infections for sepsis.
So if somebody comes in and they've got pneumonia, and they've got fever and chills, and they've got a cough, and they don't feel good, does that mean they've got sepsis, or they can get sepsis?
So that's a very important point, and we need to differentiate. Not everyone with an infection and everyone who's listening to this necessarily has sepsis. So let's talk about pneumonia. If it's just pneumonia, then it's the lung that's effectively sick. And so the person may be coughing, bringing up phlegm, may have a fever. But when it starts evolving into sepsis, the idea is that the whole body starts to show effects, and there can be a lot of symptoms associated with that.
Can you easily tell if it's going from simple pneumonia to sepsis? Is it easy to tell, or is it hard to tell?
It can be difficult, and so I think the first thing to understand is what are the signs or symptoms that it's progressing. So, for example, not just a fever, but a shaking chill, like a teeth clattering chill. If the skin is cool or clammy, elevated heart rate, becoming more short of breath. And then another one, and probably one of the most important ones that we see, is when people start to, their mentation or their thinking starts to be affected. Maybe they're hard to wake up. Maybe they're confused. If there's an infection and you have a family member at home that starts to show signs that they're not thinking clearly, that is a big warning sign that it may be evolving into sepsis.
Big warning sign. If it is evolving into sepsis, is there a critical time to get to medical care quickly?
So that's part of the reason why we're having this discussion today, is that early recognition and early getting to medical care quickly can absolutely have an impact on the outcome. The statistics tell us that in severe sepsis, where the organs are starting to be affected, a single 1 hour delay in that first dose of antibiotics can increase the chance that somebody's not going to survive by up to 8%. And so we want to recognize it early and treat it early.
Now, you mentioned the lungs. Pneumonia can go into sepsis. And you said urinary tract, skin, and GI. What type of urinary tract problems can go into sepsis?
So first of all, just a garden variety urinary tract infection could, or an infection that has spread all the way up to the kidney. Another important point is that sometimes the progression to sepsis isn't just about the infection, but it's also about the host. So for example,
the person that's got it.
The person who's got it, yeah. So some people are more susceptible. A perfect example would be someone who is undergoing chemotherapy for a cancer. During that period of time after they've had the chemotherapy, their immune system is very suppressed. And when your immune system is suppressed, what might have been just an uncomplicated urinary tract infection has the potential to progress very quickly into sepsis.
So if somebody is on chemotherapy, they're more susceptible to sepsis.
Right.
Somebody's got diabetes. Somebody's got other medical problems like that.
Absolutely. Diabetes, people who have kidney failure and are on chronic dialysis. Actually, another risk factor is just certain ages. So sepsis tends to occur more frequently in those who are over 65, and then it also in those in their first year of life. Infants less than 1 year old, it's more common. I do want to make the point, though, that you can be perfectly healthy and get an infection and it still progress to sepsis. It could happen to anybody.
So we have to look for chills, rigors, confusion, maybe loss of blood pressure at home. What would a person feel like? Give me an example. Somebody's home, urinary tract infection, they're going to sepsis, and they better know about it.
So some things that the patient themselves might feel would be that they were, first of all, their whole body is starting to feel awful, aches and pains that are out of proportion to anything that's going on. And they might even already be on antibiotics. That's just another point, is just because you're on antibiotics doesn't mean it's impossible to go into sepsis. The fever, the cool, clammy skin, maybe family is recognizing that they're just not themselves, that they're not talking right or acting right, those kind of things.
It's time to call 911 and get to the emergency room?
Absolutely.
So when a person gets to the emergency room, how's the diagnosis established?
So first of all, it can be difficult to diagnose because a lot of those things that we just described, the increased heart rate, being more short of breath, pain, those can be associated with other conditions as well. But hospitals around the country have initiatives where they're trying to make sure healthcare providers are also very aware of the signs and symptoms of sepsis. And so if there's an infection suspected and you start to see those signs of that it's starting to affect the other parts of the body, then we often move forward with the idea that it looks like sepsis. We're going to go ahead and treat and then determine as we go what exactly is going on.
So the skin and the GI tract and all were the others that were about 11% chance of developing into sepsis are the causes of people that have sepsis. So is there treatment and prevention available?
So there's absolutely treatment, and there's definitely ways we can avoid infections.
And that's what we're going to be talking about, treatment and avoiding infections, when we come back. A lot of information for you. You'll want to stay tuned. We're talking with Dr. James Shamiyeh, board-certified pulmonologist, head of the sepsis program at the University of Tennessee Medical Center. We've been talking about sepsis. That's a body's response to overwhelming, life-threatening response to infection, symptoms, fever, chills, confusion, rigors. You know you're sick, something's going on. Think of sepsis. Get to the emergency room quickly. 1 hour can mean the difference between 8% worsening. James, what a wonderful discussion. Once we find out if the patient has sepsis in the emergency room, what is treatment?
So first and foremost, and we'll talk about it in a little more detail, is that first dose of antibiotics and to continue antibiotics. What we try to do, if we have an idea where the source of the infection is, we'll pick antibiotics that target that area. If it's pneumonia, ones that are good for the lung. If it's the urinary tract, antibiotics that are good for that. Often though, if the patient's very sick, we will give 2 or 3 antibiotics in the very front end until the situation declares itself a little bit more, and then we can try to target the antibiotics more specifically.
So you're going to cover gram-negative, gram-positive, just about everything initially, and then when you really know what it is, you back away from some and keep the big baby going.
Right. That's exactly right.
Okay, so you've got antibiotics, very important. Start them quickly, quick as can be.
Right.
And then what else other than antibiotics?
So some infections are actually, they wall themselves off. That can be called an abscess, for example, and antibiotics don't get into those areas. So for example, a regular pneumonia with sepsis, antibiotics do pretty well, but if the infection has walled itself off, sometimes we have to do procedures to put a drain into that area so that we can drain that infection out.
So it would be like a boil on the skin, not with sepsis, but a boil, you'd have to incise it and let it drain maybe.
Right.
So you may have to do that in the urinary tract or in the lungs or in the skin or the GI tract.
Absolutely, yeah.
Wow.
Right.
So we relieve the site of the bacteria, and so now we've got antibiotics, we've opened up things, we know where we are. What else is important?
So some other things that we do routinely, depending on the specific needs of the patient, intravenous fluids is very common.
Why is intravenous fluids important in sepsis? What's happening in the body that you need fluids?
So part of that is that we want to maintain the blood flow and the oxygen flow to the vital organs. And so particularly if there's issues with blood pressure, that fluid can help maintain the blood pressure and maintain the flow. Now, if we've given what we feel to be enough fluid and we're still having problems with blood pressure, we have other medications. They're IV drips that can actually support the blood pressure, raise the blood pressure, again, to try to make sure those vital organs are getting what they need.
So do you monitor the vital organs, the urinary tract, the urine outflow, the amount of oxygen that's getting from what we're breathing into the body? Do you monitor that at all times?
Absolutely. The more severe the sepsis, the more different things that get closely monitored. Generally speaking, more severe sepsis is going to be admitted to an intensive care unit, and on a minute-to-minute, hour-to-hour basis, we're looking at heart rate, blood pressure, oxygen saturation, and urine output.
So you've really got close communication with the patient's disease process and the sepsis. So that's antibiotics, fluids, oxygen?
Most patients will have some degree of breathing issue, and then they'll use oxygen.
So does oxygen help if the organ that's dying because of sepsis, the kidney, the liver, whatever, does oxygen help those organs not die?
We absolutely want to make sure that the reason the blood flow to those organs is so important is that the blood carries the oxygen. It's the oxygen that the organs need. And so if the person is breathing fine and doesn't have an oxygen problem, then they may not need extra oxygen, but we absolutely don't want them to have a low oxygen level, because what's a low oxygen level from the lung side is going to affect then every organ in the body.
If somebody has moderate sepsis, moderately severe, not horribly severe, not mild, what is the longevity in the intensive care with fluids, antibiotics? Is it 3 days and then you know you're going to do well, or is it 2 weeks and you know you're going to do well, or everybody's different?
Everybody's different. It can be absolutely variable. If it's caught early, then hopefully it turns around fairly quickly. And the way we know that somebody is ready to leave the intensive care unit and move to a regular hospital room is usually if their breathing is under control and they're not requiring assistance with that, and if we're not having to use drips in the IV to help support their blood pressure.
Now, the mortality rate we said was 10 to 50% in somebody that has sepsis. So if you get it early and you get the antibiotics and you get so you got to be able to recognize it early, and that's partly to be encouraged by the family at home as well as the doctors.
Yeah, absolutely. I mean, I do think you bring up the mortality rate. That's something that we want to make sure everybody understands. We talked about 1 million total cases with anything from different statistics, anywhere from 25 to 50% mortality. So you're talking about, you think of it this way, that's say maybe 280,000 patients a year or 700 patients a day who die of sepsis.
Wow.
And so if there is the ability to intervene early by recognizing early these signs and symptoms, then you want to come in. The CDC even recommends that if the family suspects sepsis, that when they get into the emergency department, they say it. We're worried about sepsis, that kind of thing.
That's interesting, because I always say if you listen to the patient, they'll be able to tell you what's going on.
Right.
So they need to come in saying, I'm afraid we've got sepsis. So now we've treated it. Hopefully the patient has done well. They've survived. We'll talk about the long-term effects in a little bit. Can we prevent sepsis by doing certain things? Keep that person from getting it.
So if sepsis has to start with an infection, then the prevention tends to be how do you prevent infections from occurring? And so one thing is vaccination. The most everybody, it's recommended get a flu shot. And the flu can lead to pneumonia, and we know pneumonia is one of the big drivers of sepsis.
So flu shot can keep people, and 40,000 people will die each year sometimes of the flu.
Yeah.
So that may end up in sepsis. Get your flu shot, keep you from having pneumonia.
Sure.
Secondary pneumonia.
Then there is, the most common type of pneumonia is something called pneumococcal pneumonia, and there are actually 2 vaccines that are quite good at preventing that pneumonia. Now, the Center for Disease Control has a lot of recommendations about who should get which vaccines and at what age you should get it. So this is really a situation where people should talk to their personal physician and just ask the question, have I gotten the vaccines given my circumstances and my age that I should get to make infections and sepsis less likely?
So the people with the pneumonia part say, have I got my pneumonia shot? And there's 2 different kinds of different recommendations. So flu shot, pneumonia shot, vaccination, any other vaccinations that you think of that are, what do we do about prevention? We can do more than just vaccinations.
Right. There are other vaccinations. There's one that college students who live in dorms for something called meningococcus that can cause sepsis. But there are other things we can do as well. So one very basic thing that we all take for granted is hand washing.
Now, who does the hand washing, the patient or the people coming to see the patient?
Well, it should be every care provider, the patient, the people who come to see the patient, people who aren't even in the hospital. It's important. You're going to minimize your chances of catching something with hand washing, and so that is good across the board.
If somebody's in the hospital with a serious problem and you know you've got a cold, don't come into the hospital. Wear a mask. Be sure that people know. Common sense things will help us keep from spreading infection from one person to another.
Absolutely, yes, right.
James, what happens to people if they recover from sepsis? Are they completely well?
So some people are. Some people have a complete recovery and just get back on with their life. There are other survivors, particularly for severe cases of sepsis, who maybe were not particularly healthy to begin with, who are left with some after effects. And that's the other reason why early recognition and treatment is so important. The classic example of that would be the person with chronic diabetes who already has some degree of issue with their kidneys, and they get into a full-blown case of sepsis, they survive, but their kidneys don't make it all the way through. So they're left with being on dialysis sooner than they might have otherwise been after the episode of sepsis.
So the message I'm hearing is, sepsis is something we should all be aware of. Sepsis is something we need to try and diagnose early and begin treating early. And there are ways that we can prevent it by simply washing our hands, getting vaccinations, staying healthy, exercising, eating right, getting 7.5 hours of sleep, and doing what we say in the Dr. Bob Show. James Shamiyeh, you're a wonderful teacher. Thank you for coming to the Dr. Bob Show.
Thank you.
Wow, a lot of information for you and a lot of responsibility for you to be able to recognize sepsis early. Going to want to stay tuned. We're going to be talking about connection between high blood pressure and how our brain works, and also bunions. They can really be a problem. A lot of information for you. I want to thank Dr. James Shamiyeh. Wonderful discussion on sepsis. Recognize it quickly, get it treated quickly, and survive. Thanks, Dr. Shamiyeh. And now for questions from you, the viewer, that I think will be important to your health. Dr. Bob, question number 1. Can high blood pressure affect the brain? It's a good question because we know that people with high blood pressure have increased incidence of stroke. They have increased incidence of kidney failure. They have increased incidence of heart attacks. So what does it do to the brain? Well, when there's high blood pressure, the high blood pressure beats against the vessels that go to the brain, allows those blood vessels to get hardening of the arteries where cholesterol will deposit in those arteries, and the brain doesn't get the amount of blood flow and oxygen that it needs. Actually, the brain needs more oxygen than any other organ in the body. So when we don't give it enough, we start leading into dementia, people that don't think well, people that have problems with communication. That can occur in the front part of the brain, or it seems to be associated with possibly even Alzheimer's from a standpoint. That the same thing we do to improve blood pressure will improve people delaying the onset of Alzheimer's disease. So that's exercise, diet, sleep, laughter, the things that we talk about. All of those help lower the blood pressure, decreasing the salt in your diet. That will all help, and it will allow the brain to function better later on. Do you know your blood pressure? Every time you go to the doctor's office, know what your blood pressure is. If it's high on at least more than one occasion, you need to be sure, should I be treated for this? Because if you do it at an early age, it will decrease the chances of getting heart attacks, strokes, and problems with the brain. So be sure and know what your blood pressure is, because it can affect how you think, and it can affect the brain. Question number 2. Dr. Bob, are bunions hereditary? That's sort of a cute question, but actually the fact is people that have bunions, and we'll talk about what bunions are, with a family history have a higher incidence. So let's talk about bunions. In the big toe of the foot, the big joint there, if there gets to be an overgrowth of bone, it will push the great toe to the outside, and there'll be a protrusion right there. That's called a bunion. It can be very, very painful. What's it due to? It can be due to heredity. It can be due to the shoes that we wear are too tight, and they push the great toe over, and we start getting a little lump there, and that lump there gets painful, and it hurts, and shoes hurt. So we have to go to the foot doctor who can tell us what we can do to take the pressure away from that bunion that's there. Sometimes we need surgery to relieve that. So the bunion is a huge problem that can be handed down from heredity. People with flat feet frequently get bunions. People that are wearing improper shoes frequently get bunions. But know if you've got a bunion, it can be treated. It can be treated without surgery, but sometimes surgery is needed where they remove part of the bone. That straightens out the big toe. And then we have to start getting serious about the kind of shoes we wear and how we treat our feet. I remember a physician told me one time, remember, Dr. Bob, your foot is your best friend and very slow to heal. So be sure that we take care of our feet with proper hygiene and wearing shoes that are comfortable and give us room for our feet to sit down on our shoes. Well, that's all the time that we have for this show. I hope you've enjoyed it as much as I have. Remember, there are things that we need to do in the Dr. Bob Show. We need to be exercising. We need to exercise. It's probably the most important thing we can do 7 days a week, 6 days a week, 5 days a week. Needs to be 30 minutes a day for 5, 6, or 7 days a week. Alternate between aerobic activity, where we walk, where we get our tennis shoes, where we run, where we jog, or weightlifting. Both are very, very important as far as exercise. The more we exercise, the better it makes our blood pressure, the better it makes our heart, the better it makes our health. It reduces stress. It makes us feel better, helps us lose the pounds that we all want to lose. So remember, exercise has got to be an important part of your life. Get your tennis shoes out, get with it, and have a good time. Also, eating properly. You know, we know more and more about what good foods are, and we look at foods over the counter and we see what composition of protein and carbohydrates are in the food, so how much fiber is there. So eat properly. Be sure that you start the day off with a good breakfast, breakfast of fruit and fiber. Nothing wrong with snacking in the middle of the morning. Be sure it's a small snack, a good food. Eat a soup and sandwich for lunch. Have a little snack, half of a banana in the afternoon. Cut your calories down, but eat good foods. Because if you eat good foods, you'll stay healthy, your weight will evolve what you want it to be, and you'll be healthier. Remember, we want 7.5 hours of good sleep. If you're not sleeping well, talk to your doctor about why that is. We need to be sure that the room is dark, that our covers are great, and that we're getting 7.5 hours of sleep. Know what medicines you're taking before you go to bed, and be sure that you get that sleep that will make you refreshed. And most of all, what do we like on the Dr. Bob Show? It's that giggling and laughter in your life. If you laugh a lot, you are going to stay healthy and happy.